My name is David Rowland. I'm currently Head of Corporate Policy at the General Dental Council, and I'm responsible for implementing the General Dental Council's response to the Francis Report. The Francis Report was published in February of this year and was based on an inquiry into appalling standards of care provided to patients at Stafford Hospital 5 years ago. The review focused on the overall system which was in place to protect patients and found that it had failed. The report made 290 recommendations. One of the key findings from the report was that there was a failure by healthcare professionals to deliver basic standards of care. The report also found that the hospital didn't listen to the concerns which were raised by patients and their carers and ignored many of the concerns. In addition, the regulators who were there to ensure that good care was provided to patients weren't sharing information effectively, and patients didn't know who to complain to. Finally, the report found that healthcare professionals weren't being open and honest with patients when things went wrong, and the report makes a number of recommendations in relation to these issues. The government expects that all those in the health service and all regulators will take on board the lessons from the Francis Report. The General Dental Council, if it is to protect patients effectively, will also need to take on board the findings from the report. Dental professionals will also need to address the lessons from the report in terms of how they provide care to patients. The General Dental Council has developed an action plan in response to the Francis Report recommendations. There are 4 key actions. First, in order to ensure that dental professionals are honest with patients about when things have gone wrong, we will issue guidance. You may have heard in the media and from government about a duty of candour for healthcare professionals. We already require dental professionals to be open and honest with their patients, but following the publication of the Francis Report, there's an expectation from government that all healthcare professionals, including dental professionals, will be able to explain to patients what went wrong and why. Second, in order to ensure that we take on board the views of patients in the work of the General Dental Council, we'll develop an online patient panel. Now, this will allow us to take on board their views when we're developing, for example, our standards and our guidance. Third, in order to ensure that we share information effectively, we will work closely with the NHS and other regulators, such as the Care Quality Commission in England, to develop information sharing agreements. And fourth, we're also seeking to raise the profile of the General Dental Council amongst the general public through publicity campaigns, so that there's a greater awareness of the work that the General Dental Council does, and also that patients know who to complain to when things go wrong. The General Dental Council is still waiting to hear back from the government about how it would like to take forward the recommendations contained within the Francis Report, and we expect to hear more about this in late autumn of this year. Now, we will obviously keep the General Dental Council's response under regular review, but we're aiming to deliver the final action plan before the end of 2014. More details about the action plan can be found online on our website.